Welcome to Mindful Objective, the podcast where we take a grounded, holistic approach to understanding your health challenges in the modern world. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. Today's episode is all about your questions. Again, mindfulobjective.com/podcast. You can submit your question. So we're going to cover a wide range of real-life concerns in this episode, from muscle tension that won't quit and period pain that has been dismissed by their doctor as normal, to weight loss resistance, to sleep struggles, immune burnout, and fibrocystic breast discomfort. So these aren't just symptoms, they're signals. And in this episode, we're digging into what that can mean from an integrative health perspective with practical ways to support your bodies naturally. As always, quick reminder, this podcast is for informational, educational purposes only. We do not diagnose, cure, or treat any illness or disease. So let's dive in. Listener question number 1, Jonah, 38 years old. Hi, I'm Jonah. I'm 38. I've been dealing with chronic muscle tightness, especially in my upper back and neck. I stretch, get massages, and stay active, but the tension always seems to come back. I don't sit all day, and I'm not under extreme stress. Could this be something deeper, like mineral imbalance or inflammation? Jonah, a great question, and this one highlights how the body's tension often signals something beneath the surface. So chronic tightness, even in someone active like yourself, may not be a structural issue. It's often biochemical or neurological. So one common contributor is magnesium deficiency, particularly magnesium glycinate or magnesium threonate. This mineral, magnesium mineral, helps relax muscles at a cellular level and is depleted by stress, caffeine, and even sweating, which a lot of people do not know. You may be getting enough in your diet, but your body might not be absorbing it efficiently, especially if you have digestive issues. So another area to explore is electrolyte balance, including calcium, potassium, and sodium. Muscle contractions and relaxation depend on precise mineral ratios. Adding a pinch of sea salt and lemon in your water or using electrolyte powders without the added sugar could help. You also may want to evaluate inflammation and the role of your nervous system. So muscle tightness often reflects fight or flight state. Your body might not actually be in danger, but your nervous system may be perceiving it. And this could be due to poor sleep, unresolved trauma, gut issues, or it could also be blood sugar swings. So try daily vagus nerve exercise like deep humming, cold face plunges, or slow nasal breathing to help downshift your system. Finally, if massages and stretching aren't making a difference, consider trigger point therapy or look for the fascial health. Chronic dehydration, poor lymph flow, a sedentary job history could also affect your fascia mobility. So tight muscles always aren't about posture. They're often about inner balance. So again, look at minerals, hydration, inflammation, and make sure your nervous system tone, you want to tone that down to make a lasting change. So listener question number 2, Carla. I'm Carla, 41, and my periods have become increasingly painful over the last 2 years. Cramping is intense, and I feel drained for days. My OB says everything is normal, but I feel like something's being missed. I want to understand this from a holistic view. Is this just part of aging, or could it be related to diet, inflammation, or hormone detox issues? Carla, you're on absolutely the right track, on the right way to look deeper. So painful periods, especially when they worsen over time, are not something to ignore. So even if your lab tests come back normal, in integrative health, we explore several key areas when period pain shows up. First, this often points to estrogen dominance, either too much estrogen or not enough progesterone to balance it. Symptoms include cramping, heavy flow, breast tenderness, and mood swings. Estrogen dominance isn't always due to hormone production. It can also be about how well you're clearing estrogen out of your system. So that means when your liver and gut are key players, like in your estrogen and progesterone. So if your liver is overburdened, so if you think about like alcohol, medications, toxins, it may not break down estrogen efficiently. So if your gut isn't eliminating properly, estrogen can be reabsorbed. You want to support this by eating cruciferous vegetables, such as broccoli, kale, cauliflower. Use ground flax for fiber. Staying hydrated and regular. Consider supplements like DIM or calcium D-glucarate. You want to do this with a practitioner, like just guidance of a practitioner. Make sure you're doing the right balance and the right the amount. So second, your period pain is often worsened by inflammation. So high intake of processed foods, sugar, or seed oils can increase this. Compounds that cause they'll cause your uterine contractions. So again, these high sugars, processed food, and seed oils are definitely not good. It increases inflammation in the body. So anti-inflammatory foods like turmeric, ginger, leafy greens, and omega-3s, again from flax or fish, can help reduce the pain naturally. Third option would be low magnesium levels are usually often involved. So again, magnesium relaxes smooth muscles like your uterus. So try magnesium glycinate daily, especially for a week during your period. Also consider tracking your cycle. So pain the first 1 to 2 days with clots may point to stagnant blood flow, which can benefit from gentle movement, castor oil packs, or abdominal massage. So like you said, this is not just aging. It's your body asking for support. A functional hormone test, nutrient replenishing your nutrients. The other thing would be an anti-inflammatory lifestyle. This could all reduce pain and restore balance. Again, you want to get the inflammation down. You want to understand the cause and make sure you're taking the proper supplements and your body's regulating your hormones properly. So listener question number 3. Hi, I'm Deshaun. I'm 52. My issue is falling asleep. I'm not stressed out. I don't drink caffeine late. I try to unwind, but I'm still wired at night. I lie awake for hours. I tried melatonin, but it makes me groggy in the morning. What could be disrupting my sleep rhythm, and is there something I'm missing? What should I do? Deshaun, this is more common than people realize, and your question hits on something really important. Trouble falling asleep isn't always stress or caffeine. So let's start with your circadian rhythm. Melatonin production is triggered by darkness and a drop in body temperature. If you're exposed to bright light, especially from screens at night, or if your room is warm, your brain may delay sleep signals. Try wearing blue light blocking glasses 2 hours before bed and cooling your room to about 65 to 68 degrees. Next thing you might want to try and address is look into your blood sugar. So if you're eating dinner early or skipping meals, your blood sugar may dip too low at bedtime, causing your body to release cortisol and bring back up. It kind of wakes you up, keeping you alert. So try a small protein plus fat snack before bed, like almond butter or boiled egg, and see if that helps. So melatonin isn't always best for long-term fixes, and for some it causes a lot of grogginess. For me, it definitely does. I can't take melatonin. A lot of people I know can't. So you might respond better to magnesium glycinate, L-theanine, or glycine, all which support calm without sedation. So remember that. So melatonin's making you feel sedated. You can try an alternate method such as magnesium. Always consider your nervous system's tone. Many people live in a subtle state of go, go, go. And even if you don't feel stressed, your body hasn't downshifted. So try a 5-minute vagal toning practice. Again, that's deep belly breathing, humming, or short guided meditation to help reset your body for rest. Lastly, hidden cortisol imbalances can disrupt sleep onset. A 4-point saliva test, which we do here, can confirm this. If your cortisol is high at night, herbs like ashwagandha, holy basil may help. Use strategically with guidance. Again, you want to do the proper dosages and the good quality brands out there. So again, work with a practitioner. So sleep isn't always about being tired. It's about ailment, right? When your environment, hormones, and nervous systems are in sync, rest comes naturally. So another good question. Listener question number 4. And again, today we're going to discuss 6 questions here. So listener question number 4. I'm Monica. I'm 35. I've been trying to lose weight for the past year, counting calories, working out 4 to 5 days a week, and even doing intermittent fasting. But the scale won't budge and I'm exhausted. I had my thyroid checked and it just came back normal. Could there be something deeper that's slowing my metabolism? So another great question, and we did kind of touch on weight management in episode 15. So if you go back 1 episode, you can listen to this more in depth. But I'll just still cover this answer. So Monica, again, you're another one that's not alone. This is a frustrating experience for many women, especially in their 30s and 40s. So the truth is, weight loss resistance isn't often about willpower or effort. It's usually about hormones, stress physiology, and your metabolism adaptation. So even if your thyroid levels are normal, standard labs often miss subclinical conversion issues like poor T4 to T3 conversion. Consider a full thyroid panel, including free T3, reverse T3, and thyroid antibodies to get a full picture. Again, we do this at Mindful Objective. A lot of medical physicians do not run these labs in depth, so that's where we come into play. So one other thing let's talk about is cortisol. So overtraining or extended fasting can elevate cortisol, especially if you're already under daily stress. So high cortisol leads to increased insulin, which, blocks fat burning and promotes abdominal weight, even if you're calorie deficient. So try cutting intense workouts down to 2 to 3 days per week and swap some sessions just for walking, strength training, or restorative movements like yoga or Pilates. Again, yoga and Pilates are great. And same with walking, all things you can do as we age. So also consider your protein intake. Many women undereat protein, which is crucial for metabolism, muscle repair, and satiety. So again, a lot of people say, oh, I don't want to eat a lot of protein. I don't want all these muscles, but it's not always the case, right? You eat a lot of protein just for your body to process it. I mean, for your body to heal. And there's a lot of reasons we need protein. So aim for 25 to 35 grams per meal. Undereating is generally can backfire. Your body may go through a conversion mode. Make sure you're not dropping below your basal metabolic rate for extended periods of time. Like, again, a lot of people are over-exercising. So inflammation, gut health, and detox capacity also affect weight. So a sluggish liver or poor digestion can slow hormone clearance, especially estrogen, cortisol. Support detox with cruciferous vegetables, lemon water, fiber, and daily sweating. Last thing you want to do is track how you feel, not just the scale. Are you sleeping better, less bloated, more mental clarity? These are all signs your metabolism is healing, even if weight is slow to move. Again, that's where we say food tracking and water intake and liquid intake tracking. So start there. We always say that's number one, even before coming a client. Start tracking your food, see where you're at. So again, your body isn't broken, it's protective. With the right support, it can shift into fat burning, energy production state again. So take it day by day, track your food initially. Listener question number 5, Tyler. Hi, I'm Tyler. I'm 27. I've been getting sick a lot lately. We're hearing this a lot, especially nowadays. Colds, sinus infections, random fatigue. I eat clean and get 7 to 8 hours of sleep, but I feel like my immune system is just not strong. What are some possible underlying causes for low immunity? And are there any natural ways to rebuild? My medical doctor says I'm fine, but I know I'm not. Tyler, thanks for bringing this up. Frequent infections and fatigue at your age are signals worth paying attention to. Let's explore a few core systems involved in immune resistance from a functional health lens. Again, we're seeing this a lot, especially nowadays. First, the foundation of immunity is in the gut, right? Your gut and have that gut and brain connection, two very important parts of your body, gut and brain. So around 70 to 80% of your immune cells reside there. Even if you eat well, factors like past antibiotic use. The other thing would be hidden food sensitivities or microbial imbalances like candida or low beneficial bacteria can impair signaling. So consider adding a high-quality probiotic and eating a wide variety of fermented or fiber-rich foods to nourish your gut lining. Again, if you have candida or something like that, fermented foods and say probiotics can make things worse. So again, that's where we go based on symptoms. We may want to test for this too. So it's kind of touchy subject, but you could always try, probiotics. Next, check your micronutrient status. So deficiencies in zinc, vitamin D, vitamin C, and selenium are incredibly common and can lower your defenses. Even slight drops in zinc or vitamin D can impair the ability to fight off viruses. A simple blood panel can assess these. The other thing too is episode 14. We kind of discussed the foundational nutrients that body needs. So it's another podcast to listen to, episode 14 of Real Talk. And we kind of discuss foundational nutrients that are really needed for the body, supplements. Also look at chronic stress and sleep quality. Even if you get 7 to 8 hours of sleep, the quality matters. So waking up groggy, tossing and turning, or shallow breathing can impair nighttime immune repair. So tools like nasal breathing, magnesium, glycinate, or different kind of herbs like the reishi mushrooms may support deeper rest. Your lymphatic system also plays a role. It doesn't have the, so your lymphatic system, a lot of people, this goes back and forth, and I think it's getting talked about more and more. People are starting to understand their lymphatic system plays a big role in their body. So that's something people should look into, their lymphatic system and how to support that. So we'll touch it on another episode too. So it doesn't have a pump like at your heart, so it relies on movement to circulate your immune system and your immune cells and clears waste. So rebounding, brisk walking, or even dry brushing can stimulate it. Again, you hear that a lot. Dry brushing is a big thing nowadays, but that's for your lymphatic system. Lastly, avoid over-sanitizing your environment. While hygiene matters, exposures to natural bacteria from pets, the outdoors, and real food builds immune intelligence. So that's why you see so many hospital workers, so many people that work in schools and stuff. Sometimes they're less sick than others. But I think nowadays, after the pandemic, we're seeing a lot of people sick all year long, right? And there's a lot of reasons out there, a lot of research being done to identify the different populations, why they're being sick so often and why others are not. So you're doing many things right. Now it's about refining and restoring. So support your gut, optimize nutrients, and give your immune system tools they need to bounce back stronger. And again, Mindful Objective, visit us, follow us, submit your show question, mindfulobjective.com/podcast. And you could, there's a button on there. You could submit your question, or you could also listen to different podcasts. And remember, we do testing. You could get supplements at a discount if you visit the website. So again, mindfulobjective.com. So listener question and last question for this episode, number 6. Serena, she's 46. Hi, I'm Serena. I'm 46. Over the past few months, I have had reoccurring breast tenderness, and my doctor says I have fibrocystic breasts. Some people know this as popcorn breasts. I was told it's common and not dangerous, but it's uncomfortable and worrisome. Could this be linked to hormone imbalances, liver health, or something I'm eating? Serena, thank you for raising this. While fibrocystic breast changes are common, they're also a sign your body may need hormone support, especially in the second half of your menstrual cycle. This tenderness is often linked to estrogen dominance, where estrogen outweighs progesterone. This could happen either because excess estrogen, sluggish detoxification, or low progesterone levels. Around your mid-40s, progesterone naturally declines, so estrogen effects like breast swelling can become more pronounced. So again, we see this as women age, it's a little more common. So your liver plays a key role here. It breaks down estrogen for excretion. So if your liver is overworked or undernourished, estrogen may recirculate into the body. So you want to support this with a liver detox. And, we do have like 21-day detox, a 7 and 21-day detox out there. So again, mindfulobjective.com. And there's information on there about 21-day detox. Cruciferous vegetables like broccoli, kale, cabbage, lemon water, or dandelion tea. Regular elimination, so aim for daily bowel movements. You might also benefit from DIM, or calcium D-glucarate, which may help clear estrogen metabolites, especially if you're, it'll clear it, especially if the type associated with the breast tissues for sensitivity. So just consult a practitioner first, right? We want to work with you hand in hand on the right dosages and stuff. So other good ones out there to research are nattokinase and serrapeptase, which are enzymes, and they help with anti-inflammatory properties. So research suggests they may help break down cysts by dissolving fibrin, reducing inflammation, improving blood flow, potentially shrinking cyst size. Caffeine and high-fat dairy can also exacerbate tenderness in some women. So try reducing both of them for 1 or 2 cycles and note if you see any changes. So nutrient-wise, look for iodine, magnesium, vitamin E, and B6. These support hormone metabolism and reduce fluid retention in breast tissue. Lastly, what you want to do is track your cycle, track the time. So if symptoms peak around ovulation or luteal phase, that's a clue to focus on liver and progesterone support during those weeks. Your symptoms aren't random. They're messages from your body asking for a little more balance, right? With the right tools, you can reduce discomfort and feel more in control. Again, this is fairly common, so a lot of people sometimes freak out on this, and it's understandably. But there are things to do to kind of deal with this, right? Breast tenderness and cysts on the breast. So to wrap things up in this episode of your listener question and answers on Mindful Objective. So today we explored 6 powerful health questions that reflect so many people are dealing with daily. Tight muscles, painful periods, stubborn weight, sleepless nights, recurring illness, to hormone breast pain. Again, what you're feeling isn't random. It's your body communicating. And when you learn to listen through the lens from an integrative health perspective, you gain the tools to respond intelligently, compassionately, and effectively. So a reminder, this podcast is for informational educational purposes only. We do not diagnose, cure, or treat any illness or disease. If something in this episode spoke to you, share it with someone who might be facing same struggles. Again, there's a lot of us out there facing the same struggles. Pass it on. You never know who needs to hear it. So to submit your own question for a future episode, again, visit mindfulobjective.com/podcasts with the S. And follow us at Mindful Objective on social media for more insights, tools, and support. So until next time, stay curious, stay compassionate, and keep tuning in to what your body's trying to tell you all along. Stay well.